Good morning and welcome to our second annual Career Pathways in Behavioral Health. Explore, connect, engage. We have an exciting few hours planned for you. Our hope is you will learn more about the field of behavioral health, the breadth of careers, pathways to reach different positions, and most importantly, we hope to inspire you to enter the field. My name is Caroline Bunn, and I work with SummitStone Health Partners here in Larimer County. Today's event is presented by the Behavioral Health Committee for the Northern Colorado Health Sector Partnership. The Sector Partnership brings together industry partners to problem solve common challenges and improve health in our communities. This event was created to address the challenge of the increasing need for behavioral health professionals in our region. I want to thank CSU Career Center for hosting this event and the City of Fort Collins as our sponsor. A few housekeeping items. Please keep your phones aside and minimize distractions in order to get the most out of the event and our content. Please stay muted during the presentations and use the chat box during the Q&A portion of each lesson. If you need technical help at any time, click the breakout room button on the bottom menu if using a computer and the top left corner if using the phone app. Then select the technical help room and a committee member will help you. You can also message in the chat for a host to add you. Please take advantage of this opportunity to connect with speakers. They want to connect with you, ask questions, and engage. And without further ado, let's kick this off. We will start with the direct service panel. I'd like to introduce my friend, MJ Jorgensen, who will moderate the panel.
Thank you, Caroline, for that great introduction, and welcome everyone. My name is MJ Jorgensen. I use they and them pronouns, and I'm with the Health District of Northern Larimer County on the Community Impact Team, and I'll be the moderator for this panel today. During our panel this morning, we'll share our professional and sometimes personal journeys into the field of behavioral health, and our passion for this field is tremendous, and we hope to inspire you all to join us. I'd like to introduce Christine McCue with SummitStone Health Partners, Megan Lane with Banner Health, Victoria Cordova with LifeStance, and Kate Sherrill with CSU and Boltz Middle School. We'll start with giving each of you a 5-minute talk on your journey and why you're passionate about this work and behavioral health. I'd love to start with Christine and your experience and what brings you to behavioral health.
Sure, well, thanks for having me. My name is Christine McCue. I work with SummitStone Health Partners. I am currently the peer program supervisor. I supervise a program of peer specialists, and that's something that I am myself as well as the supervisor. I consider myself a peer specialist. I'll just give you a little bit of a background about how I became a peer specialist. I came from a very broken home. I have law enforcement and drug involvement from a very young age. I fought a 15-year battle with meth addiction, and something finally clicked, and I decided after a long journey, many rehabs, 5 years in DOC, I decided that I wanted something more in my life. So I actually was in community corrections in Larimer County, and I started taking CAT classes to be a certified addiction counselor. Didn't know where I was going to be able to go or if I was going to be able to get a job with my record, but I kept pushing. I stumbled across a peer specialist job for a community mental health center in Greeley. And I was like, this sounds like it was made for me. It was like persons with lived experience who want to help others on their journey to wellness and all these things. And so I was very excited and I took the job offer. And I worked at about 5 different facilities within the community health center, detox treatment centers, crisis centers, walk-ins, respite centers, just a long line of peer specialist roles that I was in until I moved over to SummitStone to be the supervisor of the peers. And I think that that's where my passion is driven, is that it's something I've had lived experience with, and that's kind of the role, is that we use our lived experience to inspire others on their journey for recovery. And I think that that's the biggest part of it, is using our personal experience to inspire others' journeys. And I guess I can just share with you my personal synopsis of what a peer specialist is. And a peer specialist is an individual with lived experience who has been trained to support those who struggle with substance use disorders, mental health, or psychological traumas. These individuals share tools, skills, and resources that have helped them transform their lives out of similar situations. Their personal experience with these challenges provide them with the expertise that professional training cannot replicate. So somebody once told me that addiction is a education that nobody would pay for, and I felt that one. So I guess that's just a little bit about me and why I'm so passionate about what I do, because I think there's something so inspiring about somebody that's actually walked the walk and can help people. So yeah.
Thanks for sharing, Christine, and what an incredible journey. And thank you for sharing with us today.
Yeah, no problem. Thank you.
Yeah, I'm going to pass the mic over to Megan. And Megan, can you just give us a little picture of your journey into this work?
You bet. I'm very happy to participate today. I think this is a really exciting opportunity to get to share, and I get to hear everyone else's stories, which is really fun. So I really appreciate the invitation. My journey into behavioral health is a little bit different. It comes from the healthcare side. I started out my career on the administrative side of healthcare a long time ago and started to recognize that I had more of an affinity for patients than I did for the administrative side. So over a long course of time, worked my way towards my bachelor's degree. I used to work with pregnant teens. I was their labor coach, their delivery coach, their breastfeeding coach, etc. There was a home down in Lakewood that supported these teen moms, and unfortunately it's since closed because we all know how there's no funding for things, which is really, really unfortunate. But it started to open my eyes to the fact that pretty much everybody struggles with something. And there's that very cliched saying, you know, always be kind because you never know what battle someone else is fighting. But I started to really recognize how that was affecting every part of what should be a normal experience for someone, and how, you know, behavioral health almost has this stigma. Well, it does have the stigma to it that affects people's ability to get the care that they should receive, like any of the rest of us would receive. So once I went to nursing school, I started to kind of head towards behavioral health because it became more clear. It didn't matter whether you were working on the cardiac floor, whether you were working labor and delivery, whether you were working in an outpatient setting, your patients that struggled with mental illness didn't have the same experience in their healthcare journey that others did. And it became kind of a passion of mine to really work towards equitable, safe, effective care for patients. And I ended up in acute psychiatric settings. So I typically have worked acute inpatient psychiatric settings. So once a community partner has determined that an individual is unsafe enough that they need to be placed on an involuntary hold in a psychiatric setting in order to get that care they need, I very much looked at it as no different from being placed in a medical floor for care for a medical condition. And so that's kind of been my journey. I am now on the geriatric unit at McCue in Loveland. I am the director of nursing for that unit, and I absolutely love it. I get to take patients who have lots of medical conditions as well, but their overlying problem is a behavioral health issue. And if we just are going to treat their diabetes, but not treat their behavioral health concerns, you're never going to get ahead. You're never going to set them up for success in the outpatient environment. So I really like this combination of medical and healthcare, or medical and behavioral health, because I get to do both. But what brings my patients in is a treatable condition in most cases that they're just not getting care for. You know, like I said, everybody is fighting some sort of battle. Sometimes it's more overt. You know, you have the gentleman on the street corner who's talking to somebody you can't see. His is very out there, but then you also have the patients who never externalize that struggle. And you know, it affects them very much. They can't do the same things that the rest of us could do, or they maybe just need a little bit of a bump and a little bit of help. So being able to do that in a way that doesn't judge for something they can't control and that they did not ask for is really kind of my platform, and really how my career has gone and the direction that it's headed. So I appreciate this opportunity. I'm a huge advocate for absolutely safe behavioral health care, but very much so in the medical setting.
Awesome. Thank you, Megan, for sharing. Incredible work you're doing over at McCue. And I so agree that, you know, those chronic health conditions are oftentimes linked to these behavioral health conditions
Very
so
much
deeply.
so.
Yeah.
And you can't just write off it as, oh, it's psych, it's psych. That's not necessarily, they are linked, like you say, MJ. Sometimes it's very much intertwined. So
yeah, absolutely. Thanks for sharing, Megan. Victoria, what have you got for us over at LifeStance? What brought you there?
Hi, yes, thank you. Thank you for having me. I got to work with Megan before, so it's fun to see her on here since, we're in this different world right now of not getting to see people. So yeah, let me tell you a little bit about it. Thank you for having me. I was really excited to be able to come do this because when I started out my venture toward becoming a licensed professional counselor, I had a very, direct view on what this profession looked like. And I wanted to help people, of course, but I thought that would be one-on-one counseling. And I've had a unique career path with lots of different experiences. So I thought it would be fun to share that with people looking into behavioral health, because I've done a lot of different things in my career so far. So I am a licensed professional counselor. And my master's is in marriage, family, and child therapy. And so when I started off, I was at UNC. I got my bachelor's in psychology, minor in sociology. And I was able at that time to work with Weld County and go into seniors' homes and support them through case management needs. And it was a lot of fun. And I liked specifically our mental health population at that time. So at that level, I was able to already get to work with people who had comorbidities where they were dealing with something medical as well as a behavioral health concern. And that drove me toward wanting to get my master's to be able to be a licensed therapist. And again, thought I'd be sitting side by side with my one-on-one client, but quickly learned that I did love these other worlds. So I was getting my license and I was working with sex offenders and domestic violence offenders. And that work was a lot of fun in that type of environment for behavioral health. Your identified patient is actually the community. It's not the person in front of you, because you're trying to provide safety and well-being to the community while doing any level of rehabilitation that particular person is able to have, which is vastly different depending on their illness. But just a side note about those particular populations, in the state of Colorado, we have amazing management boards for people who want to help treat people with a sexual offense or a domestic violence offense. So I was able to work with those management boards and become certified as an evaluator to do both. So there are specialized career paths within that. I didn't stay with it as long as I thought I would, because then I got to learn this whole world of crisis management, and I learned that I loved being able to help people in crisis. And so I hopped over to Banner and was able to help people in the emergency department when they were in crisis, when they were feeling like they wanted to hurt someone else, hurt themselves, or they were psychotic and out of touch with reality and needed to be assessed and probably go to see Megan or someone on the inpatient unit, whether they were seniors, adolescents, or adults. And so I got to do that a little bit. And then I hopped over to inpatient world and got to help people when they were in crisis. When people are on inpatient units, they're usually there for 3 to 5 days, sometimes longer, sometimes shorter. But I got to work with them to help them to kind of bridge them over to an outpatient setting, because of course the journey doesn't end when you leave an inpatient facility. So I did a lot of case management there with supporting them with all the different things they might need. Worked my way up into management and got to help other clinicians in those settings, inpatient, outpatient, and in the ED, and did that for years. Started losing my connection one-on-one with clients, and luckily in this behavioral health field, again, for students, like, depends what time of life you are personally in. I was in a point in my life where I could be on call 24/7 and help people and work odd shifts, and that was great. Now I was starting a family, and I get a little more flexibility at LifeStance now, sitting in front of my clients and getting to work one-on-one with them and having a different kind of schedule that isn't 24/7. And so that's been a nice shift too. Missing inpatient for sure, because it's an incredible environment. But that's been a little bit about my journey.
Thanks, Victoria. You have really run the gamut across different systems, haven't you?
That's why I thought it'd be fun to quickly
Yeah.
share through it, because there's lots of options. Yeah.
Yeah, absolutely. Thank you for sharing all of that. Kate, why don't you tell us how you got into school systems? What brought you there?
Thank you for having me. So my journey is very different. My bachelor's degree is actually in information systems technology, where I worked for a large global company when I first graduated, and that was right before a big dot-com bust. And so I saw a lot of people lose their jobs almost 6 months after getting my job. And so through that experience, I thought that I wanted to do career counseling of adults and work with adults. And so I came out to CSU to go to grad school. I have a master's in counseling and career development, and started working with adults. I worked with individuals in the community corrections. I worked with individuals at the workforce center. And then I was working with a program called the Education Life Training Center in town, which at that time was serving low income and people who English was not their first language. But then I was also working with students at CSU in a program that's through the TRIO program. And TRIO is a federally funded program that serves first generation, low income, and students who have barriers and disabilities in their educational process. And so through that, I started to really engage in academic and career work and shifted my focus from working with adults to working with students. Upon graduating from graduate school, I got a job working with veterans at Front Range Community College, and then I worked in an administrative manager role with students who were at risk. So students who were not doing well academically and needed help with study skills, life management, decision-making, that sort of thing. That then led me to working with graduate students at Colorado State University. And I still have that role part-time, where I work with STEM graduate students to help them identify careers and paths outside of academia. But a large component of what I was doing was talking about how do we get students into science, technology, and math fields. And so that led me to a high school. And so last year I did an internship exploring a career change at Rocky. And then I decided that I actually wanted to work with middle schoolers. So I've been at Boltz this year, working Boltz Middle School here in town, working with middle schoolers. And I have to say that I absolutely adore the role of a school counselor. Being a school counselor in a middle school is an amazing thing for me. Because I have the lens of academia behind me, I know that college is not for everyone. And so getting to work with students who can still dream big and still have so many options and potential to talk about what those options are, whether it be through a place like Front Range Community College or through a place like CSU or Metro State, or through like an apprenticeship or technical trade. And so I've really enjoyed that. But I do think that my area or focus is trying to open up opportunity and have people look at, you know, like that lens of those individuals I worked with who were laid off and the trauma that they experienced through that. And so trying to give people the skills that they need to rebound and to be resilient is, I think, my focus as a counselor.
Thanks, Kate. It sounds like you've really worked through the various life circumstances that bring people into a need for support around mental health and substance use, whether that is planning your journey into your future or kind of dealing with your now, and the repercussions of the environment you're in. And I'm just really excited to hear from you all, because look at the wealth of experience and the vast knowledge that is on this call. And so I have a couple of questions prepared for our panel, but I'd love to hear what the participants on the call want to hear from the panel. And so just drop those in the chat, and my good friend Lori Stolen will kick those over to me, and we'll get your questions answered. But while we wait for some of those to queue in, I'd love to hear from each of you, and maybe in this order of Christine, Megan, Victoria, and Kate, like we did our introductory conversation, of what would be one thing that you'd like to share with the audience about the field, and in particular, how do you tie that into your journey, and what's something you've learned that you'd like to share? Christine.
Sure. There's so many things. I would say it's forgiving. It's a very forgiving community. It's a very welcoming community. So, I mean, I have the great pleasure of working with people that I actually like in my company now that were actually on my treatment team years ago. And, you know, they treat me as an equal. They're not like, you know, just because I knew you in a different capacity, that you're not equal to me now. So I think just being able to be welcomed, it's forgiving, and that's what it's about. It's about helping people change and be accepted and all of those things. So I think, you know, it's okay to dream big. So
I would say my biggest piece of advice is to stay open to opportunity and to where your path leads you. You don't have to start out right away saying I'm going to be X, Y, or Z in this field, because you never know what's going to really capture you and where you're going to find your passion. I think that's clear from the way the four of us have gone through this career path, that there are so many different opportunities and so many different ways to work in the mental health quote unquote industry or field, that just stay open to where it leads you, because you just don't know where you're going to end up.
Yep, I would probably echo some of that. I agree when you look at all of us and our diversity within the field and where we've been and where we might have thought we were going to be. Along the same lines, though, as what you have heard from both of them, is the idea of kind of making sure you hold on to the people you've been able to meet and gain experience from in the field, because it's a forgiving, like Christine said, community. It's a tight community. You end up getting to see each other in various settings, and everyone's so supportive, and you can learn from one another, right? Just because you're new versus someone who's been in the field for years, everyone's still learning. We're always growing. And so making sure you're using your resources, I guess, is the best way I can put it.
So I'm going to come at it from a career counselor lens, and that I would really recommend that students do internships and get experience. So I think that if you are drawn to helping others, there's such a vast way that you can do that, while you're in school, whether it be in high school, and you do a job shadow, or if you are starting out at a community college taking classes, that you are reaching out, because one thing that there is usually enough of is need, right? There's need for people to help. And so I think that real world and real life experience can kind of give you a lens into what is a good fit for you. So don't be afraid to kind of get your toes wet in the water to figure out where your niche or where your passion is.
Thanks, everyone. And that's actually a great transition for one of the questions that popped up in the chat. There's a undergraduate advisor from the UNC psychology program, and they are wondering what was one class or experience during your learning years that was most helpful for you to prepare for this moment and other moments in your career. And maybe go in the same order. We'll just keep that going so we don't get confused since it's Zoom.
Well, I guess, so I didn't go to a university or take any official training, but I am a CAC 2, so I'm a certified addiction counselor class 2. And I think, I don't know, so much has prepared me, but I think being able to look at it from a different lens, being on both sides of the tracks for my personal journey, learning, you know, I think when I was in my younger years going through it, I thought, oh, they think they know everything, but they haven't been here. But being on the other side and trying to help people and having both those lenses, I was like, you know, these people that are in this profession are in it because they want to help. And that's, it's not just something you just do. You have a passion for it usually. So I think a lot of things have prepared me, but just all the experiences and all the people that are just willing to lend a hand and share their knowledge. So
I would say that some of the most helpful classes have been communication classes across the spectrum. You have to learn how to communicate with people, and that means putting yourself in uncomfortable situations and basically faking your way through it. So I would say communication classes where you learn how to be present, how to be focused, how to be in that moment, and then work on your own stuff afterwards. If you're nervous, but you can fight through it and you can develop those relationships with your clients, you're going to be golden in that. So communication, very much so.
Again, I think I would just, maybe it's because I worked with Megan in the past, but and I'm going right after her, but the idea of, to echo what she's saying, is so helpful in my undergraduate program. I was able to do like 3 little mini internships at UNC, and it was so helpful to do that during another class when I could bring back to the classroom in the moment experiences and say, like, this was uncomfortable, or this was new, or this was a unique situation, and get like actual feedback from my professor and from my peers, to then go back into that same environment while I was in those, so that it was more of a hands-on ability to learn in the moment from those outside of the classroom experiences. Mm-hmm.
So for me, I think mine's going to be a graduate school class that I took. It was a contemplative class on various religious and spiritual belief systems that individuals hold. And I think that class I go back to not only for self-care. Like, I think that one thing that it happens is burnout, and basically having the ability to look at things and to go inward has been helpful for me personally, but also in my work with students. I work with students from all different countries. I work with students who come from very different backgrounds. And in the last 2 years in the public school system, that is also the case. Not everyone's religious or spiritual beliefs are what I was raised with or even know about. And so having that opportunity to kind of open my eyes and be open and connect with various spiritual beliefs, I feel like has really been beneficial in my work with both students and parents.
Awesome. I think yet again, just the wealth of experience across the sector, across like life trajectory on this call is just phenomenal. And I think when we're talking about transitions here, that's the next question here is, how was your transition from your previous role into this career? What were the rough spots? What were the wins? Those types of things.
So from being a drug addict, hopeless, all of the criminal, considered a criminal, what all these things, that I had all these labels, and then I went to the other side. And I think honestly the hardest part of the transition or the journey from one lifestyle to the other was wanting people to want the change. So, you know, everybody will hit a rock bottom at their own time, or everybody will be willing to change when they're ready. Even if you help the same person multiple times, it's hard not to want to shake somebody and be like, I know what you're going through, but trust me, this is how it's going to end. So for me, that was a huge thing for my transition into the journey that I'm on now, is just really being patient with people and meeting them where they're at and understanding that this is each and everybody's journey. And even if we have to help those individual people multiple times, it'll happen in their time.
Thanks, Christine. I think that is so incredibly impactful, and just knowing what this looks like firsthand is so critical to being able to provide those services. And we are getting an obscene number of questions through the chat, so thank you all. And I'm going to start directing the questions to individuals rather than the whole group. And so if you want to hear the perspective of one person rather than just me picking at random, please include that in your chat. So I guess I'd love to hear from Megan on this question too. What was that transition like for you, since you've gone through a couple of different transitions through the health sector?
Yeah, it's, I wouldn't say it was the easiest transition. I think for me, the biggest hurdle was when you end up in a position that you don't like, or there is something about it that doesn't work well for you. Making sure that you are evaluating what it is that doesn't work for you while staying focused on what your ultimate goals are. And if your ultimate goals are to still remain in the same field, or at least some subsector of the field, how do you get there while not, while still doing what you were basically hired to do? So we all have a role to play, and you're still taking care of patients while you're maybe looking forward in your own personal, but stay focused on where you're at while you add that then additional journey on. So sometimes it's not always going to be a great fit, and you have to decide when it's time to cut that cord and then move on to the next. But it's not an easy decision to decide that.
Yeah, thank you. I've got a couple questions for Christine, so I'm gonna pass these both over to you. And so the first one is, how scary was it for you to turn your life around? This person is disclosing that they had a pretty rough childhood and realized halfway through their college major that it wasn't for them, and they're just worried and scared about what that new transition could be like. And also, how difficult was it for you to obtain your supervised hours for CAC licenses, and what's your advice around that?
Sure. So for the first question, yeah, it's a scary journey. I actually have an esthetician license from New York, so I changed careers midway. I decided that laser removal was not, hair removal was not something that was going to make me where I wanted to be. So it's okay to change. And I value that, it's all, I wanted to help people feel better about themselves, but then I wanted to do it in a different light. So I changed. It can be scary. I think you just have to take the leap and just do it. I didn't know if I was going to be able to do anything because I have a criminal record and I have these things, but I pushed and everybody told me it wasn't going to be possible. And here I am. So you just keep going, so I think it can be scary, but I encourage you just to keep going because that's the only way through it. So, and for the second question for my CAC hours, I was fortunate to be on with community health with North Range Behavioral Health in Greeley, and I obtained most of my hours there. So I was lucky to be able to do that, as well as SummitStone that I work at now. While working my position, a certain amount of my work hours, along with going to CAC supervision classes monthly, I get them. So it can be challenging to get them unless you are currently working in a role where you can be supervised by a CAC 3 or a LAC to get those. So yeah, that is a definite challenging part. So I would say try to get in with a community health organization. It's the best way.
Yeah, those connections are critical in those certifications. And speaking of connections, people are wondering how to get their foot in the door, particularly around trauma-informed care. And if you're new to the community, any advice for folks who are moving into Larimer County and wanting to get their space in this work? And since this is a question that's kind of reiterated a couple of different ways, I think it would be helpful to go down the whole panel. So again, that order would be Christine, Megan, Victoria, and Kate.
Okay, so getting in the field, that's the question, right? Sorry. So I guess you just have to kind of look what's out there. And for me, I didn't know it was possible. So I traveled from Fort Collins to Greeley for years because that's where I was able to kind of get in and do it. So I think you just have to kind of feel around and I think I joined like some Facebook groups and I was like asking around in my community, like local Fort Collins moms pages and things like that, just about if they, knew any connections. And I think it really just is about finding different things and different lights and different paths. I also made a lot of great connections when I did my CAT classes through Kim Bappy for Colorado counselor training. She's amazing. And I made a ton of connections through that. So I think getting your foot in the door on my perspective is just about networking for people. So.
Yeah, I would echo that very much. Don't be afraid to network, put yourself out there, talk to your professors. Don't be afraid to walk into a building and ask questions, pick up a phone and make phone calls, because you never know if you're going to connect with somebody who either is willing to step out and help you or can at least direct you to somebody who can. So it is uncomfortable because you're really kind of putting yourself out there as you're new to the career, but the more people you can meet and, tuck away in the back of your mind or exchange an email and save that email because you may cross paths with them again. I think it's all about putting yourself out there and asking around. And certainly, if you happen to be in the ED for something, it doesn't hurt to just be like, hey, do you mind if I introduce myself to your assessment person, for example? So it's uncomfortable, but the more people you meet, the better. And I would honestly say your professors are going to be a huge resource for that. They are well connected in the community.
That was my first thought too, was my professors. Looking back at the connections I was able to make did start there. And then as you start to grow in your career path, you're going to meet people in and outside of wherever you're working that you're going to want to continue to tuck away their business card and kind of remember why you met them and what their connection was. And then any opportunity you get for things like this is going to be huge too. Like we said earlier, with this community being big but small and kind, I don't know if I've met anyone in our Northern Colorado world that isn't like, here's my email and, just connect. So it is a very welcoming community in that sense. So yeah, taking that leap, but making sure you kind of hold on to everyone you meet and getting to things like this and community meetings, events, virtually, in person again someday, all that will be very important.
So my understanding is that there are high school students and potentially here. So if I were a high school student, I would reach out to my high school counselor to see about programming that's like concurrent enrollment. If they have programs that allow you to do job shadows. I also think that if I were in high school, I'm going to go back to the volunteering. Now is a great time to reach out to places that you think you might want to work at and say, I'm a high school student and I'm interested in this area and I would love to come and volunteer for you. And not being afraid to do that direct contact, to reach out and put yourself out there. For those of you who are in college or at a community college, there are career services. If you're at UNC, they have a great career center. If you're at CSU, they have a career center that Matt Leland, who is on this call, is employed through. They have great connections. So in addition to your professors, I also think that there are resources on campus that you could connect with. And then if you're in the Fort Collins area, I think the Larimer County Workforce Center does an amazing job. They have a youth transition program that does amazing work. They do workshops on networking and on your resumes and things like that. So I also agree that networking is really important. But I also think that the resources that are there in this community to help support you can also be tapped while you're networking.
Absolutely. And I think that networking sounds like really taxing and all of those things. And I know I felt pretty overwhelmed by networking when I was in high school and college. And so networking doesn't have to look like this or going to a job fair. It can be grabbing coffee with a professional in the field that you're interested in, and just really getting that time to connect with folks and letting them hear your passion for the field will help them open doors for you. And so don't be afraid to build one-on-one relationships in that way. And this question is for Megan. This person's going into nursing and they want to find the area they're really passionate about. How were you able to recognize when it wasn't a right fit?
So time. I think one of the amazing things with nursing, with the nursing career field, and this is a little bit different just because it's kind of, specialized nursing, but you can try so many different things in nursing. I think the average length of time that a nurse stays in a particular specialty is 2 to 3 years because there's so many opportunities. So I think if you go into a BSN program or a nursing program, you're going to do your clinical rotations in most fields in an acute setting. And that's going to give a good insight into what you really like. Pay attention to what kind of lights you up and what makes you think, I really want to do this. And then don't be afraid to pursue a job in that, even if you ultimately know that you want to end up in a more behavioral health focused, or you want to end up in a cardiac focused location. Try different ones because that's the beauty of the field. So I think you'll know because, well, for me, I started in labor and delivery and it was just like, this is my thing. I love every single part of this. And then eventually it wasn't my thing anymore. And I wound up in behavioral health. And now I'm like, this is my thing. I love it. And it is connected for me in those patients that do need behavioral health, regardless of what field they're in the hospital setting. But I would say you'll know.
Awesome. I have to recognize and honor folks' time and say we've got about 2 or 3 minutes left. And so in closing from each of the panelists, I'd love if you could give us like a 30-minute, 40 or not minute, second soapbox on why folks should enter this space, starting with Christine.
There's so many good reasons. I can think of all the good reasons and not really any bad reasons. I think there's just something empowering about breaking down the stigmas. So anything in this field is to help, is breaking down the stigmas, no matter where you come from, what you identify, any of it is accepted, and just helping people kind of be okay with who they are. And that's okay. I'm very open about my story about being an addict, being a lesbian, being a felon, any of it. I'm proud to say that that's part of my story. And so be proud of who you are, but join the community to break the stigma. So.
Yeah, I would echo some of that. Nobody asks to be mentally ill. Nobody asks to be diabetic. Nobody says, I want to be marginalized. I want to receive less care because I have a mental illness. They're no different from any of the rest of us. They're still human beings. They are still people who deserve exactly the same care that somebody that doesn't have an outward mental health struggle deserves. So I would say if you find passion in that and you want people to be receiving, same services. You want them to be treated fairly. This is a great field because you can really make an impact on someone's life. You can really change someone's life with the simplest things. Sometimes it's hard, but sometimes it's just really simple. It's just caring. It's just showing them a different way. So I think that's for me. There's no difference. We're all the same. We all have illnesses regardless of what they look like on the outside.
Gosh, there's so many things I feel like I could say in this moment, but I'm trying to think back to high school and undergraduate and graduate, the idea of deciding whether you want to go into a field like this. I'd say that if you feel like it's a passion and it feels like you're being pulled toward that direction, you're needed. It's an area where we haven't given it enough attention through the years. We have a lot of society that still looks at it like, just stop feeling that way, just get over it. And that's not possible. Even if you look at it from a medical model, for a person, the brain chemistry, everything that's happening in your brain just is kind of going against you. And we need advocates. We need you. So if you feel pulled, you feel passion, our community needs you, and future clients truly need you. So.
I think for me, it would come down to something similar to what the other panelists said, but really about the power of connection and that connection that you create with another human being through sharing kindness and support. To me, that provides me with joy and it fills me up. And so when you think about what you want to do for an extended period of time in your life, because I'm proof that you can change, right? You can always adapt and change. It's look to things that make you feel full. Look to things that bring a smile to your face on a daily basis.
Thank you to our panelists again for sharing your expertise and your journey and world in this work. And thank you all for attending this panel and the Health Sector Partnership for really putting this all together. And I hope you have a great day filled with lots of sessions that bring you to work with us.
Thank you, MJ, and the rest of the panel. Wow, what great journeys that we've heard about, and just thank you so much for helping us understand where you've been, where you are, and the path along the way. And thank you very much. So let's give a hands up to our panelists, and especially for MJ for moderating. So thank you. Next up is a session to better understand the breadth of behavioral health field. We will have Deidre Chavis with North Range Behavioral Health, and Jennifer Zimmerman of Colorado State University will be presenting. So just a reminder to please stay muted, and please, 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 like you did this last session, use that chat for questions. Ask away. So take it away. Thank you.